Hey friend, let's have the honest talk most guys never get. You want to know what length women actually prefer? I'll tell you. But first, I need to clean the glass you've been looking through. The internet pushes extremes because extremes get clicks. Real life is quieter, kinder, and frankly, a lot closer to average than you think. Three quick truths to set the stage. First, most men are already within the medically normal range. That's not a pep talk. It's what large reviews of real measurements show. When you measure the way clinicians do, the center of the bell curve is very human, not cinematic. Second, measurement method matters. If you and the research don't use the same method, you're not speaking the same language. Clinically correct means bone-pressed length. Ruler on top, gently press through the fat pad until you feel the pubic bone, then to the tip of the glands. For girth, wrap a soft tape around the midshaft, not at the base, not near the tip. And yes, the flaccid stretched length, pull straight, firmly but not painfully, correlates well with erect length, which is why research uses it. Third, women don't assess size in a vacuum. In attraction studies, overall body proportions matter. Height, shoulder to hip ratio, posture. Size can contribute, but it rides along with those traits, and the return on size flattens beyond a certain point. Translation: bigger and bigger doesn't keep getting you the same boost. Let's anchor you with medical averages so you stop wrestling shadows. Typical erect length clusters around 13 to 14 centimeters, about 5.1 to 5.5 inches. Typical erect girth clusters around 11 to 12 centimeters, about 4.3 to 4.7 inches. A wide majority of men fall within approximately 10 to 16 centimeters, 4.0 to 6.3 inches, for length, and approximately 10 to 13 centimeters, 3.9 to 5.1 inches, for girth. That's our shared map. Now, about female preference. Old surveys asked women to imagine numbers or pick from drawings, easy to distort. Newer work got smarter. Actual 3D models, neutral color, women choose with their hands, then later recall the size to test memory. That strips away a lot of bias and gets closer to what feels right. One more layer before we reveal the numbers: comfort and safety. Vaginal tissue is delicate. Micro-tears can happen with friction and depth, especially if arousal and lubrication are low. That's part of why best isn't the same for a casual fling and a long-term partner. Short-term choices lean a touch larger. Long-term choices lean a touch more comfortable. Hold that thought. We'll get specific soon. Context changes. Everything: body, story, and setting. If we're asking what length do women consider best, we can't pretend the rest of you doesn't exist. Experiments that varied three things at once, height, shoulder to hip ratio, and penis length, found a clear pattern. Size has an effect, but it's amplified by tall stature and a strong V-shaped torso. Past a point, the benefit curve flattens, no infinity bonus for chasing extremes. So, practical takeaways for you. If you're not tall, don't obsess about millimeters on a ruler. Building your V-shape, upper back, shoulders, glutes, and posture gives more visible impact than squeezing out a tenth of an inch. Reduce the fat pad above the base. Belly fat can hide visible length. Losing it often reveals what you already have. Use consistent measurement conditions: warm room, standing, same ruler. A calm, standardized approach beats anxiety-driven remeasuring. Averages, again, so your head stays clear. Erect length around 13 to 14 centimeters. Erect girth around 11.5 to 12 centimeters. Most men land near that. Variation across regions exists, but the overlap between populations is huge. In other words, your individual habits and body composition matter far more than charts about ancestry. And now, the teaser you came for. When women handle real 3D models, preferences separate into two practical scenarios: short-term, novelty, thrill, and long-term, regular comfort, lower risk of irritation. In a moment, I'll give you the numbers for both. Before I do, I want you to remember the ground rules. Measure correctly, think in ranges, and respect comfort. That mindset will make the numbers useful instead of stressful. Okay, numbers. What women actually pick. Short-term versus long-term. Here we go. In lab setups, using neutral 3D models, women's average preferred size for a one-time encounter was about 16.3 centimeters, 6.4 inches, length, and 12.7 centimeters, 5.0 inches, girth. For a long-term partner, the preference sat just a touch lower, roughly 16.0 centimeters, 6.3 inches, length, and 12.2 centimeters, 4.8 inches, girth. Read that again. Both sit just above average, not at extremes. The short-term scenario leans slightly bigger. The long-term scenario trims a little for comfort because routine intimacy favors easy arousal, lubrication, and low friction. This lines up with what I hear in clinic all the time. Women value reliability, comfort, and the ability to tune depth and pace together. Technique and communication punch far above raw numbers. Memory note: in those studies, women remembered sizes fairly well shortly after choosing, with a slight tendency to underestimate length on recall. That matters when you hear story time in group chats. Memories drift. The ruler doesn't. Now compare those preferences to medical averages. Typical erect length approximately 13 to 14 centimeters. Girth approximately 11 to 12 centimeters. See how close that is to the long-term preference? A lot of men are already in the neighborhood. That's why confidence and context are everything. You may be agonizing over a half inch while standing on the target all along. Action you can take today, pain-free. Measure correctly, then stop doom scrolling. Trim the fat pad. Visible length improves fast. Build a V shape and fix posture. Your presentation changes more than you think. Use lube generously. It's not an option, it's comfort and safety. Favor positions that let your partner control depth and angle when needed. Hold the surgical fantasies for a second. I'll give you a safe, realistic plan next, including the only non-surgical method with consistent evidence for modest real length gains. Getting closer to the best zone. Safely. Body, mind, and method. Let's stack the deck in your favor with things that work and won't backfire. Visible length, fast wins. Lose some belly fat, especially the lower ab pad that alone often reveals more shaft. Clean up grooming at the base. Improve posture and hip position by strengthening glutes and core. These are free centimeters to the eye. Performance system, blood flow plus control. Erections are a cardiovascular event. Walk most days, 8 to 10,000 steps. Lift 2 to 3 times weekly. Hinge, squat, push, pull. Sleep 7 to 8 hours, so nighttime erections, your quiet health check, stay intact. Alcohol light and occasional, not nightly. Train the pelvic floor. 10 quick pulses, 5 slow 5-second holds, 5 full relaxations daily. Most men overuse abs and glutes. Keep those quiet and focus on the deep lift and release. This supports firmness, staying power, and recovery. Nutrition that helps, not hypes. Think beets and leafy greens, natural nitrates, watermelon, citrulline, pomegranate, polyphenols, olive oil, omega-3s, and adequate protein. Magnesium-rich foods help relaxation and sleep. Hydrate earlier in the day, taper fluids 2 hours before bed. The only evidence-based path for actual length increase. If you're asking, is there a method that truly increases length over time without surgery? Yes. Medical-grade penile traction therapy. Gentle, sustained tension encourages collagen remodeling, slow and steady. Consistent users commonly see approximately 1 to 2 centimeters added to stretched or erect length across 3 to 6 plus months. It requires patience, low tension, and many short sessions rather than brute force. Safety rules: no numbness, no sharp pain, no alarming color changes. If any of those appear, stop, refit, Reduce tension, rest. What not to do? Aggressive manual routines that bruise tissue, permanent fillers or silicone, high complication risk, or ligament cut surgery chasing erect length, it doesn't reliably add erect length and can reduce stability. Hyaluronic acid fillers can boost girth temporarily when done by a skilled physician, but they don't add true erect length and need maintenance. Here's a simple 12-week starter plan. Weeks 1 to 2. Baseline photos and measurements. Bone pressed length, midshaft girth in a warm room standing. Start the system. Daily steps, 2 strength sessions. 5 to 7 minutes pelvic floor practice. Optional low pressure pump, only as a brief warm up for blood flow, not a growth tool. Weeks 3 to 4. Introduce traction at low, comfortable tension. 30 to 60 minutes total per day, split into short blocks. No numbness allowed. Weeks 5 to 8. Build consistency to 2 to 3 hours total per day in divided blocks, e.g., 45 plus 30 minutes. Remeasure every 1 to 2 weeks under identical conditions. Weeks 9 to 12. If all is well, 3 to 4 hours total per day in blocks. Comfort first. Expect slow, steady gains. Keep the blood flow routine. Cardio and strength make everything work better. About race and region, yes, group averages differ slightly, but the overlaps are massive. Your health habits, body composition, and technique dominate the experience far more than ancestry. And since you're my friend, here's the truth I tell patients at the end of the consult. Women's preferred sizes in controlled tests land around 16.3 by 12.7 centimeters for a fling and 16.0 by 12.2 centimeters for a long-term partner, just above average, not extreme. Most men are already nearby when measured correctly. Clean up the fat pad and posture, build blood flow and pelvic control, and if you want modest, real-length change, commit to patient traction. Pair that with communication and comfort in bed, and you'll be far closer to the best zone than you ever were with anxiety and guesswork. You're not a number. You're your habits, your kindness, your ability to listen and adjust. That's what partners remember when the lights go out and the years go by.